I'm joined now by the Shadow Health Secretary, Wes Streeting. A very happy New Year to you. Good to see you this morning. Thanks for being with us. All a bit worrying this. Christmas and New Year over, and as we head into 2022, some really worrying statistics about just how many of us are going to be unable to get into work because we're sick with COVID. The Sunday Times saying up to 1 in 10 staff sick in the NHS. The Mail actually saying 1 in 40. But whatever the numbers are, it's a concern. What's the answer?
It is a concern, and Happy New Year. I think the key challenge for the government at this moment in time is to get testing right, because if we've got sufficient testing in place, that's a key tool in managing the risk of the virus, managing the spread of the virus, keeping pupils learning as the school term starts, keeping NHS staff safe and other workers in critical national infrastructure safe, and avoiding the need for further restrictions, particularly in England. So that's the big message for the government today. I am concerned that we've had shortages of tests. The Health Secretary told me only 3 weeks ago that the availability of tests wasn't a problem. Clearly it is. And if we get testing right, we can avoid the need for further restrictions. So that's the big message for the government today.
Yeah, the government's saying it's tripling the supply of lateral flow tests to 300 million by the end of the month. But, of course, that is still some way off. So you say no more restrictions. What about masks in secondary schools then? Kids going to have to wear them in the classroom now?
Well, I think in terms of schools, if the choice is between having masks at schools or children missing schools in huge numbers, of course, we want to keep pupils learning. That's got to be the priority. I think there are two things, though, that the government can and should be doing. The first is on testing. Pupils should be testing twice a week. There's lots of evidence to suggest that hasn't been happening properly. So the message for government is get the tests in place, make sure pupils are able to test twice a week. And my message to parents and pupils is do take the test, because the big challenge this month is going to be keeping pupils learning, avoiding mass absences, and of course making sure that staff are well enough to attend school as well. So the testing is crucial. The other thing, of course, is ventilation. Ventilation is a really big tool in preventing the spread of this virus. It's an airborne virus. We've urged the government to act on testing on ventilation repeatedly. They've made an announcement today that they're going to send out 7,000 air purifiers to schools across the country. I mean, that's only 1 in 4 schools across England, so nowhere near enough. And I'm not clear from what the government said whether this is 1 system per school or 1 air purifier per school, because obviously there's a big difference between the two. And again, I'm afraid it looks a little bit like a rushed last-minute announcement to give the appearance of doing something on a big issue where they should have taken action a lot sooner. So I think the government's got a lot more to do on ventilation in schools as well as a key defence, a key mitigation against the virus.
We're in this strange situation at the moment, aren't we, where we don't yet know what the effect of us all being able to mix at Christmas, that intergenerational mixing over Christmas and the New Year. We don't know what effect that is going to have on the numbers yet. We probably won't know for a couple of weeks. And on the one hand, you've got Sajid Javid and indeed Labour saying that more restrictions are absolutely the last resort. But on the other hand, you've got the BMA saying the NHS is already overwhelmed, it's in a parlous state, and we need restrictions now. Who's right?
Well, we're listening very closely to what some of the country's leading scientific minds are saying. I've had lots of meetings in recent days between Christmas and the New Year to get a sense of what their view is. I'm listening very closely to what NHS leaders are saying. I mean, in the end, this is the key challenge for the country. It's to make sure that the NHS isn't overwhelmed, that it's there for us when we need it. And that's not just about COVID. That's about the big pressures we normally see on the NHS at this time of year. It's also about critical national infrastructure. So I want to reassure people about a couple of things. First is that in the event that new measures are needed, Labour will do the right thing. We're not going to play party politics on votes. We showed that before Christmas. The second is we are urging government to do everything they can to avoid the need for further restrictions. I think testing is a really crucial tool in all of this, which is why I'm concerned about the testing shortages. Because in the end...
How would Labour fix that? Because we know it's an issue. How would Labour have done things differently than with testing? Because we've all been testing like crazy. We've been doing what we were told, taking tests before we meet Granny or go to the pub. Obviously, there's a supply issue. But how would Labour solve that?
Well, two things. Firstly, people have been doing the right thing. You're absolutely right. And it shouldn't have been a surprise to the government that there's been high demand for testing, because they've encouraged it. And in fact, we introduced, as part of the Plan B measures, the COVID pass scheme, where people can produce negative tests in order to access nightclubs and larger venues. So we are actively using testing. So we challenged the government to make sure there were sufficient tests in place, and were told only 3 weeks ago that was the case. Clearly it isn't, and that's not good enough. So there is a question here about basic competence from the government. Of course, we are where we are. This isn't where we would have started as the Labour Party, but we are where we are. And so if we have a shortage of tests and priorities have to be made, our priorities are keeping pupils learning, so prioritising schools, prioritising NHS staff and critical national infrastructure. That's got to be the priority for now, but the government does need to get its act together on the supply of testing. And I think the Health Secretary needs to explain why it was that only 3 weeks ago he told me in the House of Commons that availability of tests wasn't a problem, and yet now it so clearly is.
Perhaps it was because there was this messaging that more restrictions weren't going to be brought in, but we all needed to be cautious. And it does appear that we have listened to that, and we have been more cautious, and we have done things sensibly. Just before we let you go, what are your thoughts for the next few weeks, the next few months? The data does seem to be a little bit confusing in many ways, and you can understand why people are confused at the moment, because on the one hand, we have these huge number of cases, well over 150,000 cases a day. And yet, on the other hand, deaths, thankfully, don't seem to be increasing dramatically. And also the number of people on ventilators in ICU also seems to be steady and plateauing. It's very hard for people as we enter into the new year to know exactly where we're going.
Yeah, and I think it's important that politicians, whether in government or opposition, aren't complacent about the need to continually explain to the public what's going on, what numbers we're watching and why, so that people can understand the decisions we're taking. So on that note, I would just say to people that the key challenges we've got to keep an eye on this month in particular are NHS staff numbers. And there's that Sunday Times article suggesting 10% of NHS workers were knocked out on New Year's Eve, because the numbers of staff in the NHS is going to have a big impact on their availability to deliver the service. This is a people-based service ultimately. So we've got to keep an eye on NHS staff numbers. We've got to prioritise schools and making sure that children can keep on learning. And the third thing we need to keep an eye on is there are some signs from the data that there's now an uptick in the numbers of older people who are now getting the Omicron variant. So care homes are going to be a pressure this month as well. So all in all, the things that we can put in the positive column is that so far there are signs that this variant isn't as harmful as previous variants. The reason we can't be complacent about that, and this is in the challenging column, is that the virus is spreading rapidly. It is knocking out lots of staff in the NHS and other critical national infrastructure. It is going to be a challenge for schools this month. It is going to be a challenge for care homes. So the big challenge for 2022, because the virus isn't going away, the big challenge for 2022 is how we put in place the infrastructure to make sure that we can live well with COVID without having to go in and out of lockdowns or other restrictions like the hokey cokey. I understand why people are tired of that. So that means testing, I think, in particular, really big tool, crucial. And getting the vaccine rollout continuing. So if you haven't had your first, second or booster jab, do it now. It really is the best tool, the best defence we have against this virus.
OK, we're out of time. We appreciate you being with us this morning. Wes Streeting, Shadow Health Secretary, thank you.